Hi, I'm Alicia. I'm going to be your provider today.
Hi.
I just want to make sure that I have your consent to video you for United States University for my instructor.
Yes.
Okay, and this is my daughter, so I will, I'm going to adjust this just a little bit. I'm giving consent for her to be on the video. Today we're doing the EENT examination. And so we're going to start off, and I'll be talking throughout the exam as well, just trying to explain what I'm doing throughout it. First, we're going to start off with the head. I'm inspecting for hair distribution. You want to see if there's an even pattern. You're also inspecting for symmetry. You're looking for any depressions, any lesions or nodules on the head while you're palpating and inspecting. Next, we'll go on to the face. We're looking again, inspecting for symmetry, any scars, lesions, open areas. We're looking at the eyes for even symmetry. We're looking at the ears to see if they're symmetrical and with the inner eye. We're looking at the lips and the nose. We'll start off with palpating the frontal and maxillary sinuses. Let me know if anything's uncomfortable. You're looking for any pain or pressure that they feel when you're palpating these that would lead you to think that maybe they have an infection. Then we're going to go on to the eyes. We've already inspected for symmetry. We're looking at the pupils for symmetry, and we're looking to see that they're equal and reactive to light. So I'll get my pen light. First we'll check for the pupillary response. And we'll check the left eye, and that pupil is reacting. Now I'm going to, when I shine that in the left eye, I'm going to look at the right eye, and it should be reacting as well, and it is. This time we'll do the left eye and check it for reaction. And then we'll check the left eye and look at the right eye for the same reaction. Good. We're going to do some visual field checks. In this, we're checking extraocular movement, which is cranial nerve 3, 4, and 6. First, I'm going to just have you follow my finger. We'll look up, and we're looking down. We're looking laterally. Which is the fourth optic nerve, and then we're looking medially as well. We're going to check peripheral vision fields. I'm going to put my hands up like this. I just want you to tell me when you can see my fingers.
I can see them. I can see them. I can see them.
Okay. So we're checking those in all the different fields of view for her peripheral vision. Next, we'll move on to the inner eye, and we're going to use the ophthalmoscope for this. And this will be part of the fundoscopic exam. This I'm going to use my right eye to her left eye as I demonstrate this. I've got my settings on 0. I'm sorry, my right eye to your right eye. I'm going to go ahead and put this, I'm going to put my hand up here on your, put this up by my eye. I come in at an angle. I'm looking for the red reflex. Once I find that, I'm going in to look at the interior of the eye, the retina. I want to see the optic disc and the cup and make sure that it is a good ratio. I'm looking at the vessels of the eye. You want to make sure there's no hemorrhages there. And everything in that eye looks good. So this one I'm going to do the same thing. I'm going to come in with my left eye to her left, coming in from the side, placing my hand here, and then coming in and inspecting. Looking for those same structures of the eye. We're going to also inspect the eye. We want to look at the sclera, make sure it's white, the conjunctiva, make sure that there are no lesions. pull down just slightly. You want to make sure that it's a pale pink in color and that there's no hemorrhaging in the eye. You want to look for anything that's, any foreign bodies that are in there, just to make sure that the eye is clear as well. Next, we're going to move on to the nose. I'm going to change my... with the nose, we're looking for the symmetry. We're looking at the nares. We want to make sure that the patient can breathe evenly throughout the nares. So I will have you just occlude one of your and breathe in. And we could use something for her to smell if we wanted to, just to check her first cranial nerve. And I don't have anything right now for her to smell, but that's what I would do. Then we're going to go and look inside the nares. We want to look at the turbinates, and we want to be very careful looking at the mucosa of the nose, that we're not causing any trauma. We'll look for any drainage, any erythema, and obviously any lesions or sores. And everything there looks clear. Next, we're going to move on to the ears. We're going to be first starting with the whisper test. Well, let's look at inspection first. I'm sorry. We're going to inspect first. Just want to look, make sure that you've got symmetry, make sure that the pinna is in normal shape. Look for any lesions or keloids that might be on there. You can gently palpate and make sure that there's no anything uncomfortable, because that would lead you to think that maybe there is a ear infection. Next, we're going to want to do the whisper test. I'm going to occlude her ear and say a word. Baseball. And we want to do this bilaterally on both sides. Stethoscope. Okay. Then we're going to do the Weber test. I'm going to have you tell me which side you hear this in. She should feel it both on both sides. She should hear this or feel that vibration. And then we do the Rin test, where we're checking the bone and air conduction. Let me know when you stop hearing that.
Stopped.
And can you still hear it?
Yes.
And we would do this bilaterally on both sides. And it's just telling us that air is conducting better than bone, so she's hearing that still. We're going to do the internal ear exam. For adults, we're going to pull up and back on the tragus. For children, you would pull back and down. And you want to be very gentle when you're going in, making sure that there's no discomfort to the patient. Getting into their inner ear. You're looking for any excessive cerebrum. You're looking for the tympanic membrane. It should be a good pearly gray color. You want to see the light reflex there, and the malleus, and the umbo. And then you would do that on the other side as well, pulling up and back in the ear. And we're looking at all those same structures here. We're also kind of looking at the canals when you're looking, making sure that there's no discharge or anything that's blocking the conduction of air. Or not air, sound. Then we're going to go down to the mouth. So we're going to look at the lips. We're looking for symmetry again. Obviously for a child you'd be looking for any sort of cleft lip surgeries that they've had. Then we're going to inspect the mucosa of the mouth. Just have you open your mouth. You're looking at their dentation. You're looking at the buccal mucosa, you're looking at salivary glands, you're looking at their upper soft and hard palate. I'll have you stick out your tongue and say ah. Okay, I'm visualizing the uvula. That is checking the, you can see the tonsils. You're also checking for those cranial nerves 9 and 10, which is the swallow and gag reflex. I would also palpate her mouth if I had gloves on. I could be feeling for any lesions, any nodules in the mouth. You want to look underneath the tongue, especially at the vascularization and at the salivary glands down here, and make sure that they all appear pink and healthy and that you don't see any signs of lesions in the mouth. Then we move down to the neck. We're going to be doing some lymph nodes. So first we'll start with the occipital node. Then we go to the preauricular lymph nodes, postauricular, looking at the submandibular, feeling those, making sure that they're, if they are palpable, they should be soft and movable. They should not be hard and fixed. And then the submandibular, we're feeling here for the clavicular, for any nodes that you might feel. Then we also want to do a range of motion with the neck. So I'm going to have her just move side to side and then up and down. I'll have you kind of push away from me for strength. There we go. And then we can check also this push up. So we've checked all of those. We also then want to check the thyroid. We're inspecting the area. She has a small scar here from a previous surgery that I can see. We want to kind of displace the trachea so we can palpate the thyroid. We'll do that on both sides. And then while I'm feeling for that thyroid, past the cricoid bone, I'll have her swallow. And you want to just feel for normal movement there, and for any nodules there along the thyroid gland. This completes the head and neck exam. Everything appears normal and healthy. Thank you very much. It was nice to meet you.
Thank you.